Morning will walk us through how to complete the HCV treatment status screen for the HCV navigation and high-risk settings programs. So in AIRS, underneath hepatitis, we're going to go to HCV treatment status, and we're going to go up top and click add. So all clients enrolled in the program after enrollment should have a HCV treatment status record created. At that time, you may not know information around linkage to care or treatment, but for each one of the clients, they should have an HCV treatment status record at least started in AIRS. This will allow us to track where the client is in the program and be able to send you updates about where the clients are. So the date ask should also represent the date of enrollment in the program. And then from the initiative list, we want to make sure that we're selecting the HCV navigation and high risk settings program. And the first question that's going to be on the screen is the patient on medicated assisted treatment for substance use? If you do select yes, you'll have to enter the start date format. If you select no, you can move on to the next question. So the next question, did the patient attend their HCV medical appointment? So with all of our data reports, you're going to see the measure linkage to care quite frequently. The linkage to care data gets pulled right from this question. So did the patient attend their HCV medical appointment? If you select yes, the next question will be, what was the date of that first attended HCV medical appointment? If you select no, the data entry could stop here. Or if the client has a future appointment scheduled, we could click pending. And as long as we're pending for both of these questions, we'd be able to go ahead and save the record. The biggest takeaway from this is to make sure that you always go back and edit and update that initial treatment record that you created. You could do that by highlighting it, clicking edit, and then you're going to be able to pick back up where you left off with the data entry. So for this, we're going to go back to the linkage to care question. We're going to say yes that the client attended their appointment, and you're going to enter the date of the first attended HCV medical appointment. So we're going to backdate it. We'll say August 2nd. And then the next question is, was HCV treatment initiated? So again, if the client did not initiate treatment during that medical appointment, you can save the record and then come back in and update it. If the client did initiate treatment, we could go ahead and select yes. And if they did not initiate treatment, it's going to ask you for the reason why the client. So what is the primary reason the patient did not initiate treatment? So if you click on reason, you're going to get a prompt box, and there's about 20 or so different reasons in here for why a client may not have initiated treatment. For this walkthrough, though, we're going to say that the client did initiate treatment, and now the next thing that's going to be required is the start date, the treatment start date. So this date should reflect the date that the client begins taking their medication to treat for hepatitis C. So we're going to go ahead and enter a date here. And again, you could go ahead and save this record at this time. Most treatment regimens are between 8 and 12 weeks. So, there is going to be about a 2 to 3 month period where we're not going to have a treatment end date or an outcome for this client. So when you do have that information, down the road, we're going to go back in again and click edit, and we're going to update what the treatment end date. So this should be the date that the client, finished or completed their medications to treat HCV. And then it's going to ask you for what the treatment outcome is. So at the time when the client completes their treatment regimen, we're not going to know what the final outcome is. So we won't know at this time whether they're cured or not cured. Our recommended guidance is to use this completed pending final HCV RNA. Again, this is going to be a time period where, that 12-week SVR lab work is about 3 months out. So again, this might be a time where, the record may sit idle for a little bit until you have that information. The client comes back and has that final, assessment for cure. When that does occur, again, we want to edit the record, and now we'll be able to update the treatment outcome to the appropriate outcome. So if the client was cured of the virus, we would be selecting option number 1, completed cured. If it was a treatment failure, the client was not cured, we have option 12. Many times, unfortunately, we do see that the client, between that, when they complete treatment, they never come back for that final SVR assessment. So we would use that they completed treatment, but the outcome is unknown because they were lost to follow-up. For this walkthrough, though, we're going to go ahead and select that the client was cured. And then the last question is going to be, what was that date of final SVR assessment? So what was that date that they had their final lab work done? So this is what we would consider a finalized treatment record. And after we're done entering all this information, we go up top and click save, and we'll see that we have our final treatment record for this client.